Hi everybody, this is Dr. Hinson. I wanted to make this video today because one of the most common complaints that I see in the office is people complaining about fatigue. And in applied kinesiology, one of the concepts I really try to drive home to my patients is that health really is composed of a balance between three different areas of our life. As you can see here, so we call this the Triad of Health. And it represents structural, chemical, and mental. And when all three sides of someone's triad are balanced, or as balanced as they can possibly be, the more healthy a person is. So when someone comes into the office complaining of fatigue, I always tell them there's many causes of fatigue. There's structural, chemical, and mental causes of fatigue. So I wanted to kind of go over some of these with you and maybe help shed some light on if any of you are dealing with fatigue, some of the things that you might want to be aware of. So number one, structural. Now most people will think that when I talk about structure, they think, well, I'm not working out and, I'm not exercising, and all of that is very valid. Exercise actually does help us provide more energy and can really take care of a lot of fatigue. But I still know a lot of people who are very fit and who exercise regularly and are still dealing with being tired all the time, waking up tired, not feeling like, they're getting a good night's sleep as well. But structurally speaking, anytime you have spine or extremity misalignments cause the body as a whole to have to work harder for you to move, meaning the body is expending a lot more energy just to walk or just to, climb stairs, things like that. So the other thing too is diaphragm dysfunction or weakness. The diaphragm is the muscle that helps us breathe, and it's very, very common. I see this in almost every patient to some degree. You'll see some sort of a diaphragm imbalance. So they're not getting enough oxygen to their brain, which can also create a lot of brain fog and a lot of difficulties concentrating. But also, believe it or not, diaphragm dysfunction is many times a cause of digestive issues, which on the chemical side of the triangle, you can see that poor digestion is one of the things that can really create some fatigue as well, because we're not getting all the nutrients from our food. We're not breaking them down and utilizing them properly. So muscle dysfunction, that's pretty much any muscle in the body. But also on that is that muscle dysfunction, just like I was telling you about structural issues or the spine and extremity issues, part of the problem with that is that now those muscles are having to do so much more work just to accomplish everyday activities. And so cranial nerve stress is another one. Cranial nerve stress is our cranial nerves are the nerves in the brain, the ones that control our eyes, digestion, heart rate, blood pressure, and many other things, facial movement, jaw function. And so anytime someone's ever had a head injury, and I see a lot of people who've never had head injuries at all who still deal with cranial stress. And so we have to test those nerves. It's very simple, it's non-invasive, but you got to test those and find out if the body's having to expend a ton of energy in order to make some of these nerves in our brain work properly. And then the last one here is myofascial. Basically, it's the covering of our muscles. And if the myofascia is restricted or stuck, kind of like the sleeve on a shirt, if it's covering that muscle and it's stuck, it's not letting the muscle function like it should. Therefore, it creates, forces the body to use a lot more energy than usual. And then mental and emotional stress. This is actually very, very common. And I know all of us have some of this to some degree, but trouble with our relationships, marriage, children, work stress, or school stress for students, as well as past traumas, like old traumas in our life, emotional stresses, bankruptcies, divorce, things of that nature. Those things sometimes, we feel like we've kind of gotten over them, but sometimes they can still be creating stress within our nervous system. So any kind of a financial stress, and the big one I notice a lot of, which we probably will have to do a whole nother video on, is lack of sleep or lack of quality sleep. The kind of sleep that helps you wake up and actually feel restored. A lot of people don't get that, and there's a reason why. And sometimes it's because of either structural, chemical, or mental causes. And then finally, on the chemical side of the triangle, you've got blood sugar ups and downs, which is so common. Either people eating foods that cause their blood sugar to spike up really high, or people that are going too long in between meals. And this causes blood sugar levels to dip, causes cortisol levels to go up, and it creates a big problem, especially weight gain. So The other thing I find too is food sensitivities. So one common symptom, there's many we could talk about, but I'm just going to mention one. One really common symptom you see from food sensitivities is after you eat a meal, if you get really tired, that's a possible sign that whatever you had in that meal had something that your body just doesn't work well with. So food sensitivities also create tons of histamine in the body, and histamine requires a lot of things in order to break and get rid of the excess histamine, but it also puts a big burden on our liver and on our spleen, as well as our adrenal glands, which are the glands that help us handle stress and help us have energy also throughout the day. Nutrient deficiencies is another one. Nutrient deficiencies, it can be B vitamin deficiencies, it can be deficiencies that allow our body to be able to generate energy, like healthy fats, omega-3s, 6, 9s. Those are just to name a few. Toxins and poisons. I find, if someone's smoking, if they're drinking too much, any food, if you have too much of it, the body would treat like a poison or a toxin. So, the moderation in all things can definitely apply here. And then poor digestion, like we talked about a little bit earlier. If you're just not breaking food down properly, you're not eliminating those, the waste, then your body is just either swimming in toxins or your body's having to use a lot more energy to break down food. Hormonal imbalances are pretty common. I see those all the time. And hormonal imbalances create, definitely affect the way we feel, the way we see the world around us, the way we think. And one of the most common things I see in my practice are adrenal and thyroid imbalances. Most people are just not doing the things necessary that would really help their adrenals and their thyroid be able to function optimally. And then this is a big one too, dehydration. I see that all the time. People think that sodas or tea, coffee, juices, that those are hydrating, and in reality the body many times treats those things like food. And I will tell you that with dehydration, the body utilizes water completely differently than it does a soda, than it does tea, coffee, etc. So a good rule of thumb is you want to be drinking 1 liter of water for every 50 pounds of body weight. That sounds like a lot, and it may take you a few days for your body to get used to that. But a lot of low back pain, as well as brain fog and hunger and fatigue, can be caused by just simply not drinking enough water. People are drinking tons of caffeine, which dehydrates them and only causes the merry-go-round to continue. Finally, one big thing I see too is immune deficiencies, or immune weakness. Now, the thing about immune weakness is that there could be low-grade virus, bacteria, parasites, just any kind of challenge to the immune system, even air quality, allergies in general, like environmental allergies. All of those things are very stressful to the body and stressful to the immune system. And all of that can cause fatigue. So these are just some of those things. But you might ask yourself, well, how in the world are you going to know which one of all these or which ones of these apply to me? And that's where applied kinesiology and its diagnostic ability really shines. And that is, we're able to go through and utilize manual muscle testing all the different muscles of the body, as coupled with other standard methods of diagnosis, in order to figure out where a person's weakness is and what needs to be done to support that so that it's no longer a burden for them. So if you have any other questions, I'm going to post this picture along with this video. If you have any questions, feel free to email me. Feel free to message me as well. You guys have a great day. Bye.